paper towels, a little plastic wrap, and then the charcoal, obviously, and then you need some sort of binder. And so flaxseed meal works really well. You can also use psyllium husk or cornstarch. I tend to use flaxseed meal, and so I'm going to mix it up with just a 1-to-1 ratio, charcoal to flaxseed meal. And then we're going to add just enough water to make it into a paste. So, did somebody want to hold that?
Or do you want to do it?
Sure, olive oil. Thank you. 1-to-1. 1-to-1.
1-to-1 ratio. There we go.
All right. So the really cool thing about charcoal is the reason why it is so effective. Well, let's talk about what it's used for. That's probably a better place to start. So we're going to use charcoal externally for things like infected wounds, bites or stings, snake bites, spider bites, bug bites, any kind of stings, those kinds of things, because it's going to draw out that poison, that irritant, right? Internally, you can use it for things like upset stomach, food poisoning, other kinds of poisonings. And the reason that it's so beneficial and powerful for that is because it works by adsorption. So everyone's heard of absorption, right? And so absorption is like a sponge. It takes the water into itself. Adsorption is the particles, the poisons or the irritants or whatever it is, actually gets attached to the outside of the particle of charcoal. It kind of binds to it, and then it takes it away with it. And so I'm just going to add a little bit of water. What we're going for is we want to make this into a paste. We don't want it to be runny. And if anybody's tried to mix charcoal, you know that it's kind of like trying to mix dirt or sand into water. It doesn't work so great at first, so it takes a little bit of time. Part of the reason why charcoal is such a powerful adsorber is because once it's activated, it has a very large surface area. And so if it works by binding these particles to it, then it would make sense that the more surface area, the better, the more things would be able to bind to. And so prior to charcoal being activated, its surface area is really only like a 2 to 5 square meters per gram is the surface area. Once it's activated, that jumps up to about 3,000 square meters per gram. And so that's pretty significant surface area to be able to bind to things. All right, so I'm just making a small little poultice here. I did 1 spoonful of charcoal, 1 spoonful of flaxseed meal, and just enough water to make it into a paste, so it's not really drippy. We're going to leave that there. Thank you, honey. Yeah, you can look after. And then the charcoal poultice is really only going to be helpful as long as it stays moist. And so if I can figure out how to get this plastic wrap off, we're going to put a piece of plastic wrap down. There we go. I'm going to put a piece of plastic wrap down. I'm going to put a paper towel over it. I've also seen people make these in Ziploc bags. You put the flaxseed meal and the charcoal and the water and everything in a little plastic bag. And then you seal it up, and then you can mix it up in there. It saves a little bit of the mess. Well, actually, we're going to go this way. I'm going to fold it over. I'm going to do a little bit more water. So as long as it's moist, that might have been a little too much. As long as it's moist, it'll keep kind of pulling and drawing stuff out. And then I'm just going to paint this right on the paper towel in a nice thin layer. There we go. Why are you doing that? Because we're making a charcoal poultice. And so now I have charcoal spread out on that paper towel in a nice thin layer. It's not dripping, right, but it's nice and moist. And then what I'm going to do is I'm going to fold the other side of the paper towel right over it. Because one thing with charcoal is if you're going to put it on an open wound, you don't want to put it directly on the wound because it can cause some tattooing, okay? And it will work through the paper towel as long as everything stays moist. And now I have my nice little charcoal poultice. You could, make this, it's not huge. If I had covered this whole paper towel, it might be more beneficial for me to tape the edges so nothing spills out, kind of contain the mess. But that's not going to be an issue here. And now I can put this right on the skin, and we can wrap that on. I have an ace wrap, so if anybody would like a charcoal poultice, we won't let it go to waste. And you can leave that on, you can apply it and leave it on overnight. As long as it stays moist, it's going to keep working. If you have something that's a pretty significant infection, you're going to want to change it more often because that surface area will get filled up at some point. And so for pretty serious infections, we want to maybe think about changing the poultice every 10 or 15 minutes initially. You can also use charcoal in a bath, where you can add charcoal to some water, and then you could immerse wherever the wound is, the bite or whatever it might be. Maybe not an open wound, we'll do bites. You'll immerse the bite into the water, and that's also going to help with the drawing as well. And then if you want to use it internally, you just mix 1 or 2 tablespoons. It doesn't hurt to go a little heavier, so adults tend to 2 tablespoons is a little bit better. Mix that in a cup of water, stir that up, and then you can drink that. And that will help if you have any internal issues, digestive, upset stomach, food poisoning, anything like that. It'll help to bind all those irritants and then help pass them out. Yes?
Is there too much to take? Because in the past, I love charcoal myself. And I usually do capsules, so it's dry in the capsule. But I've done like handfuls, like 14, 16 capsules at a time.
Oh, my.
That's a lot. Thank you, Sarah. It can cause constipation. It can cause constipation if you take it too much. So anytime you take charcoal, you want to make sure you take it with plenty of water. And if you're already having issues with constipation, it's probably not going to be your first choice of things because it might worsen the problem. But yeah, that might be more than I would recommend, the 14 to 16 tablets, I think.
Yes. Yes.
You don't want to take it, I think it's 2 hours, right? 2 hours. You don't want to take it within 2 hours of taking any medication because it will bind to the medications. Mm-hmm.
Arlene? Awesome. And if I remember correctly, it was very quickly that he was back up and playing, and the coach was shocked about that. Yeah, thanks for sharing that experience.
Also had some good success with charcoal poultice for children over their bellies. And so upset stomach, maybe you can't get your child to take the charcoal internally, but a charcoal poultice over their belly can be useful as well.
Yeah, I'll also share that one way that we got our children to take charcoal, in fact, I think our son still likes to take it that way, is we would mix it in applesauce. And we'd call it black applesauce, and they want to eat their black applesauce. So that's one way to make it a little more child-friendly. Thank you so much, Sydney. I will also mention we're talking about things that, that draw out or that we can use as a poultice. Even something as simple as baking soda. The other day, I was in my garden, and I like to go barefoot. I just do not like to wear shoes. And I stepped on a bee and got a big old bee sting on my toe. My toe swelled up immediately. So I just ran to the kitchen, grabbed some baking soda, mixed it into a paste with a little water, put it really thickly on my toe, and then wrapped it with a Band-Aid. And very shortly, the swelling was down. The sting had been drawn out, and so baking soda is something that you can easily use in the same way as you might use. Doesn't have quite some of the benefits internally, I wouldn't take it, but for just like a bee sting, a spider sting, something like that, baking soda works really, really well too. And my husband's going to talk a little bit about bentonite clay, which is another compound you can use for drawing things out.
Absolutely. So these are useful. Bentonite clay is not going to be as readily available, obviously, as some of the other ones that you've seen, but bentonite clay is something that you really want to consider. Bentonite clay has the same concept as what you would use for activated charcoal, but with a little bit of a unique difference. Bentonite clay is phenomenal on skin, and it won't have some of the tattooing effects that some of the activated charcoal does. Also, internally, you can take it as well. And Joey, you asked this question. It's interesting because they do different things, and I want to make a comment about both of these, is that you wouldn't want to take activated charcoal, you certainly wouldn't want to take bentonite clay, and really you don't want to take baking soda, obviously, internally. We have, counsel on that. But you don't want to take these around 3 hours of food either, right? Because realize that some of these are going to compete as far as absorption for some of your vitamins, some of your minerals, and your essential nutrients that are in the food. And so you definitely don't want to take that at that point. You take that during times of sickness, and activated charcoal is great at that. One of the unique properties of bentonite clay, though, that they've studied, there's been about 2,500 studies worldwide on bentonite clay. And the reason it's so powerful is it doesn't seem to compete as much for vitamin and mineral uptake, except for potassium. So you want to watch this with potassium. So externally, where would you use it? The same kind of places that you would use activated charcoal. But the nice thing about this is the drawing power, I find personally, as far as experience, the drawing power is better on the bentonite clay for a lot of skin issues that I have than the activated charcoal, and it can stay on just a little bit easier. You don't often leave this in overnight. Some people will. My experience is that you use this for about 25 or 30 minutes, has a fantastic drawing capacity. So you're going to mix this just like you mix the activated charcoal into kind of a frosting consistency to the point that it's smooth and you can get it on the skin, and you can do the same thing that we just showed you. You can cover it with saran wrap or something along those lines and have it for a period of time until it starts to dry. When it starts to dry, at that point you want to wash it off because it's carried everything off. Wash it off and cleanse that area with the skin. You certainly can put it on the paper towel, but one of the nice things about bentonite clay is a lot of times I'll put it directly on skin so it has more of an absorptive capacity, or adsorptive, I should say, capacity than the activated charcoal does. And it's fairly easy to get off as well. I don't use it in tubs. Both of these will stain tubs. Some people want to do a clay bath, an activated charcoal bath. If you've got any kind of tub that you care about, it's going to stain it. So that would be something to be concerned about. But having something like a small pool, like one of those little plastic kiddie pools or something that you can get people into, those things are fine for that kind of situation. One of the nice things about bentonite clay, too, is it has antifungal, right? You'll hear the term antimicrobial. What does that mean? Well, you got to break it down. It can be antibacterial, it can be antiviral, it can be antizoonotic, or it can be antifungal. And one of the nice things about bentonite clay is it has some very strong anti-candidal and anti-mold capabilities. So for somebody who's fighting that internally, child that maybe has thrush, somebody that's been exposed to mold in their home, somebody that's been exposed to mold in our foods, you don't think about it, but when you get things like peanut butters or almond butters or oils that have been setting around for a while and they start to get that cloudiness to them, right? They're starting to break down. The oil started to turn rancid, which is not good for you. But part of the component of that is that there are fungal components to a lot of our food supply, which is why it's important to get that food fresh and why it's important to try to avoid any kind of fungal contamination. So when you've got oil that's separated and cloudy, that's not the best thing to put into your body. I will tell you that I do a lot of testing and I see a lot of people, surprisingly so, that have exposure to mold. And so one of the nice things about this is you can take this internally. Again, the best time to take these is away from food. So what I'll tell people a lot of times is you want to take this at nighttime. You do about a teaspoon is what I recommend in about 8 ounces of water. You stir it up, and then you'll drink that without food right before you go to bed, right? And the nice thing about this is this really helps with toxic elimination, especially in the liver. So some of the studies have shown that. Some of the studies have shown mold. Some of the studies, oddly enough, have shown that it's really helpful for eliminating heavy metals, specifically arsenic, cadmium, and lead. And so this is really a powerful way if somebody's exposed to those things and you think, well, where would these come from? You take a look at our supply, especially chicken is a lot of times finished off with arsenic before it's slaughtered because it's a natural antibiotic. We get a lot of our arsenic from that. We just had a comment up here, Josiah just said rice, and that's right, but rice from certain parts of the country. The southeast United States, around the turn of the century in the 1900s, was trying to get rid of the boll weevil and cotton, and they used arsenic-laden pesticides that are very heavy in the soil. So you want to watch your rice. If your rice is from the southeast United States, very high arsenic content. So you want to think about where you're getting your rice from. And then if you had arsenic, what kind of removal would you have? This is where things like the bentonite clay comes out. So this is a really healthy way to be able to do this. You can have, if you're going to take 18 tablets or if you're going to take 18 teaspoons of this, then you might have some problems with it. So you want to be easy on this. I generally try to have people not do it more than about 3 times a week, every other night. You give your GI a chance to rest a little bit. But this is super helpful. I don't like using it primarily, but it does have also an effect of decreasing cholesterol. So somebody that's fighting cholesterol, remember that cholesterol has to be excreted primarily through the digestive tract, right? You get rid of that through your liver when you're getting rid of cholesterol, and this will help to pick that up and eliminate it out of the body. So we had one quick question here. Oh, great question. So this is through, this is bulk herb store is this one, but we get it from Mountain Rose Herbs on the West Coast. There are some local areas that you can get it here that you can bring it in. So just look for it, but it's going to be bentonite clay, and we have all the little ones to look at up here so you can get a sense of where to get it. But this is a fantastic thing to have in your home, especially for skin infection, for cuts, for bruises, for internal use. I just used, my wife had a little buildup in one of her eyes. It's common sometimes if you don't drain well. This happens sometimes. But you can use that, and it will help pull it out. And it's done amazingly well over just a few days of being able to pull that out with a little bit of what we've used as topical essential oil. So very, very effective. You can, but again, you want to reason from cause to effect. All right, we've been given instruction on that, and the concept is, why would you be using these? And it's the same thing. So prophylactically, yes, you could, but you should think, I should have some exposure to something. If you know you've got exposure to heavy metals, or to mold, or to a bacterial component, or you're having gastric distress, well, at that point, then you've got kind of a reason to do it. If not, realize it is, and the studies did show, if people are using it consistently, they get very low in potassium. So I'm not a big fan of overdoing supplements, nor am I a big fan of overdoing medications. You've got to be in balance. Well, I usually use it for a period of time. And so if I've got a GI effect, that will be a little bit longer, and I'll use it 3 times a week for maybe a month and see how that works. For other things that are more specific, you'd use it for a shorter time period. Okay? Yes?
What did you say you used it for your wife's eye? How did you do that?
Well, so you make it into a paste, and it was on the upper eyelid, and so then I'm trying to pull and be able to get the fluid to move across that membrane.
My mother-in-law has tear duct problems. They get clogged.
Yeah, you have to be careful in the eyes, but it depends on where the tear duct is. You can get it on the top side, which is a hordeola, or you can get it on the bottom, and so there are different causes for that. Be careful with any of this around your eyes, obviously. The only one that's really, and I'll talk about it in a little bit, the only one that's really got great data for being in the eye that we have here is honey. The other one in India is turmeric. Those two are safe for the eye.
And I'll just mention too as well, this is wonderful even like cosmetically. Like if you've got a teenager or somebody who has really oily skin or is fighting with acne, you can make this with a little bit of water and put a face mask on, let it dry a little bit. It's going to pull out impurities from the skin. Yes, ma'am?
Yes, my question is, what's the difference between the bentonite and the French green clay or the red clay?
I think they're very similar, honey. Do you want to address that? I know. Sometimes we use those interchangeably.
There are clays all over the world, and they have essentially the same properties, right? Some of them have certain properties that the other ones don't. The one really why I like this is it's better studied. French clay may actually, in fact, be better at certain things. Realize that the color that you get in any of these is going to stain. Right? So that you have to think about on some of these, I find that clay stains much less than the activated charcoal on this, right? But even on this, I've had bentonite clay in tubs, and it is a stain that's really hard to get out. So the clays have similar properties. They seem to be, for certain areas, especially like I said for mold, they seem to be more effective, but they're very similar. And I don't know that I could speak exactly because I haven't seen studies, which is why I try to do this on things that we know. But you could estimate that a lot of these different clays in different locations are going to have similar properties.
Well, I've used both clays in the past, and I still use. I don't use bentonite because the way it crumbles versus I find the others a little bit
Yeah, and it depends. This is a very fine powder that this company does, and so I like using this. You're right that it can clump, and so what's the capacity for being on skin? And there are different options. I would estimate that it has probably very similar properties.
Yeah. Yeah, in the clinic, we just try to use things that we can get some research basis on. But thank you so much for bringing that up. So Sydney and Josiah are going to come up now and talk a little bit about the use of cayenne.
Absolutely. So while she's coming up, he said that clay's really good for, helping to get rid of some cholesterol. Charcoal too. You can take that internally, and there's actually quite a bit of research behind that showing that it helps to lower cholesterol levels. Now, is that your primary way to lower your cholesterol? No, it shouldn't be, but it is something that he mentioned. And also for acne, I remember we worked in a clinic. This teenager came in with, actually older, and he still had terrible acne, and we just did oatmeal poultices. Oatmeal, mix it up and just paste it onto his skin, and that really helped to draw out the toxins from that standpoint. So yeah, another excellent one. But what do we have here?
Cayenne. So we're going to talk a little bit about cayenne. So cayenne can be a really powerful medicine, I guess you could call it. The active component in cayenne that's really the most studied is the capsaicin, and it's found to be a circulatory stimulant. And so it stimulates circulation, and it does that whether it is taken internally or used externally. And one thing that we wanted to demonstrate today was how you might use it externally. I believe that Kim, the other day was talking about cayenne and using it in a salve, right? And so you can do that. You can take the powdered cayenne and you can make that into a salve, and then you can use that for different things topically. But another way to do it is to make it into a poultice, maybe if you don't have the time to go through the process of making the salve. One reason you might choose to use a cayenne poultice would be if you had somebody, we talked about hydrotherapy yesterday, and one of the contraindications to doing hot water on somebody's feet per se would be if they have some sort of neuropathy. If they cannot feel the temperature on their feet, it would then be dangerous to do hot water because they can't tell you if it's too hot, right? And it might burn them. But that doesn't mean that increasing the circulation to their feet is not a good thing or a needed thing. And so something that you could do is you could make a cayenne poultice where it is going to stimulate the circulation, but you're not going to have the risk of burning. And so what we'll do is we'll just take paper towel, I doubled it up, and then you need a little bit of olive oil. And this is probably going to come out fast, but if you have like a regular bottle at home, it'll come out a little bit slower. But you just need to drizzle a little bit of olive oil on the paper towel. And the olive oil basically is just there to give the cayenne something to stick to.
And as a carrier, as a lipid carrier to bring it into your skin.
Sure. All right. And then I'll take that from my fingers. And then where's our cayenne powder here?
It also helps to actually have some cayenne when you're making a cayenne poultice.
We have it.
Oh, good.
And then all you're going to do, and once again, this is probably going to come out fast, but you're just going to sprinkle a little bit of cayenne on that olive oil. No, you don't need very much. You just want to kind of get a little bit on the olive oil.
Do you have experience using this?
A little bit.
Do you have testimony?
Oh, I don't have a testimony per se, but I have used it personally, and it creates a bit of a warming. It creates a nice warming effect on the feet. So all you do, then you take that and you put that right on the bottom of the foot. You don't want to leave it too long because it can start to feel warm. We don't need it to be uncomfortable, right? So somebody that is maybe doesn't have diabetic neuropathy, you might not want to put this on and leave them overnight, right? Even somebody with diabetic neuropathy, you want to start smaller. And so you just place that on the bottom of the foot, and they'll tell you that they start feeling it warming up. And that's just bringing the circulation. You might even see the increase in the blood flow because of the redness, right? That's coming to the feet. And so that's one way that you can use cayenne. And then Josiah was going to talk about other ways,
Sure.
maybe more traditional ways of using it. Oh,
Yeah.
Sure.
My question, can you substitute the olive oil for castor oil?
Yeah, in my experience, yes. And coconut oil.
Yeah.
So really,
Any oil would be a fine carrier.
and that carrier, so our skin is made up of lots of cells which have a surrounding of lipids, phospholipid membrane, thank you. And a lipid, if it's in a fat, it's going to be absorbed into that cell, but water will be repelled. Yes?
Yeah, so my question would be, I believe the veins bring the blood back up to the heart. Would that help the circulation, the blood to come back up to the heart?
I mean, it's going to help with circulation systemically. So yeah,
Not
yes.
necessarily. I would say not specifically on venous return
Okay.
because that is more of a mechanical thing. So if you have,
What
but
is-
it is going to stimulate the blood flow to the area. It is going to bring blood into the area, and as long as you don't have any issues in terms of venous return mechanically, then it should continue. The improved circulation should continue, no problem.
So it's going to dilate the blood vessels, and that's going to bring more blood flow in, but you can only bring that to a certain extent, so it's also going to improve from that standpoint. But directly, I get what she's saying. So yeah,
So it could help out a diabetic person more so than, say, regular healthy person? Would that be the case?
I wouldn't say more so. It's still going to have the same effect.
Yeah, it would have the same effect, but it might be a better choice for a diabetic person over hot water.
And she said, for hydrotherapy, because they can't sense the temperature, and that is a contraindication or something to be aware of. Remember, it's not an absolute contraindication, it's just something to be hyper aware of if you've got the knowledge base to deal with that. Over here, yep.
So my question falls in line for diabetics. So I'm a registered nurse, so I know the physics behind it. My concern is, so I find that this would be something good for somebody with a diabetic ulcer that's not healing to promote circulation to that area.
Sure.
So I'm just wondering if you guys have tried that on somebody who's a diabetic.
Not an ulcer.
Yeah. Okay.
I've had someone with an ulcer, and I pack it with charcoal and golden seal. And I did the hydrotherapy first, and then I packed it with that, and I'm telling you.
Yeah, I've worked with a few people with pretty severe diabetic ulcers. Yes, okay.
To me, that works.
That works very well. So what I did is I did something similar maybe to her, but I cleaned it. This was a wound that was not healing, and actually this individual was going to go through amputation if it was not going to show signs of turning around, and praise the Lord, it did show signs. And what we did specifically is we washed it with Epsom salt, so we just put the foot in a Epsom salt bath, and also we did before that a charcoal bath, and then took it out, patted it dry, of course, and then applied honey. I think we also did at some point like a golden seal and echinacea bath. So, but yeah, great stuff. There's so many natural ways to deal with things that are probably a better first go-to thing. But back to the internal. So, externally, the cayenne can actually help to coagulate. So if you have a big cut or something and you want to coagulate that first, pressure, of course, all your first aid first. But then also it helps to coagulate when you apply it externally, which is really fascinating. We're not really sure why even 100% why blood coagulates, when it's exposed to oxygen, but it's not always the oxygen. What stimulates that coagulation cascade, or then why does it not coagulate when it's just in the blood? But when you take it internally, it tends to actually thin the blood. But externally, if you've got a cut or something, it actually, like a scrape or an abrasion, those tend to bleed for a while, or they're hard to stop the bleeding a little bit. If you put some cayenne on that, you would think that, it's going to dilate and increase circulation. But for some reason, it actually coagulates and stops the bleeding. So, we're fearfully, wonderfully made, and his creation is fearfully and wonderfully made too. So we don't fully understand everything about it, but that's the experience of many. Also internally, it's been used on many experiences. I haven't actually got the opportunity to try this yet, but I do have a friend who was having a heart attack. Not my friend who was having a heart attack, but he was around somebody else who was having a heart attack, and they were in the airplane. So the guy didn't have nitroglycerin, his own, or that's a vasodilator, but he did have charcoal, my medical missionary friend. Cayenne, thank you. Yeah, red powder, black powder, is the same. Cayenne, and he just put a little bit of that in the mouth, and you know, it's hard to say whether if it would have, you know, the clot would have rectified itself, or whether this was the remedy, but it appeared to be that this was what dilated the blood vessels and enabled that individual to survive and get to their destination. So, and it is probably causal, definitely, because there's so many testimonies of that nature where it helps to vasodilate very immediately. And
stroke.
heart attack and stroke. Yeah, which one did I say?
You had a heart attack.
Yeah, okay. Very well. Also, actually, even for my father, so the capsaicin is actually kind of good for reducing pain and for reducing inflammation. And what I did for my grandfather is he had terrible arthritis and gout, and he just couldn't sleep because of this pain. So what I did is I took some cayenne and mixed it with some coconut oil. That was my carrier, right? You want a lipid base to be able to get it into the cell where it can actually have an effect. And I also did a cabbage poultice. So, you know, oftentimes we do multiple things. Whether it's to say which one did most of the work, I'm not sure. But he was able to sleep, and he hadn't been able to sleep for weeks and weeks and weeks. So that solution, or that infusion or salve, I guess you could call it, of cayenne really helped him in conjunction with the cabbage poultice, which I don't think we're sharing right now, but that's also really good to reduce inflammation.
One other thing, you guys are going to get some handouts at the end of the class today.
Mm-hmm.
One of the recipes that's going to be on there is a cayenne tea. So cayenne, it's good in emergency situations, it's good topically, but you can also take it internally. I personally have had it work wonders on sore throat for myself. I could not get this sore throat to go away. It kept sticking around, and I just took a little bit of cayenne and mixed it in some water and drank it, and my voice was starting to come back and my throat was starting to feel better almost immediately. It does make you sweat a little, but it goes away quickly. Yes?
Cayenne and red pepper the same? You get it at a store?
No, I don't believe so. I think crushed red pepper, it's a different pepper. Yeah. I'm not sure what pepper exactly, but. Oh, Ashley
right.
had a
I'm
question.
so sorry. Ashley, thank you.
Have you ever used Golden Seal for stopping bleeding?
I haven't, no.
Well, a number of years ago, I took the end of my thumb off on my joiner,
Mm-hmm.
and we tried cayenne, and I about went into orbit, and it was bleeding pretty profusely.
Mm-hmm.
So we used Golden Seal, and then later on in the week, this was Friday afternoon, later on in the weekend, we started to use pine pitch.
Yes.
And within a few months, all the skin grew back. I mean, it literally tore the whole end almost down to the bone.
Mm-hmm.
And it healed perfectly.
That's a phenomenal testimony, and yeah, you have shared that with me, and I apologize for
How did you use the golden seal? In what form?
It was just in a
powder.
form.
Powder?
Yeah,
Mhm.
you sprinkled it on. I mean, there was nothing to save, so you couldn't go to the hospital. I mean, they would have put a Band-Aid on it. And I'd been at a medical missionary training where a guy was, the story was told where a guy was fixing a blender and somebody stupidly turned it on and tore the whole end of his finger off. And so the medical missionary at that time took and pulled the skin back the best he could, what was left, coated it with the pine pitch, and he showed me it months later. It was like normal, and that's what happened to my thumb. Normally, when you take that much skin off, the nerves are all messed up, and it bothers you in the cold weather. I'm pretty certain it was this thumb. Okay. The feelings all came back within a year's time, and everything is normal.
So do you mean pine pitch or golden seal?
So the golden seal stopped the bleeding, and then we would apply pine pitch to the Band-Aid, and we would change that a couple times a day. And like I said, after about a month, the skin came back, and everything came back to normal again. And pine pitch is antiseptic, so there was no chance of getting infected or anything. And I use it even now on cuts and stuff like that, pine pitch, whenever I injure.
Mm-hmm.
And being in woodworking, you know how it goes.
Very good.
I have all these
Another one for that. Comfrey is very good for helping any cartilaginous tissue heal and recover. I have a similar testimony of a friend, a teacher of mine, who cut off even part of the bone of a finger, and they did that, and actually he's got his finger back. So, yeah, that's pretty impressive. So a Comfrey poultice regularly applied for all sorts of things. I don't think we're necessarily covering Comfrey, but yeah, do more learning. Okay.
Thank you. And I know I mentioned the other day when we were talking about things to grow in your apothecary garden or kitchen herbs to grow. Growing cayenne is really easy. You can start it from seed and grow it just like you do any of your other peppers. And then we harvest them when they're nice and red and dehydrate them. And once they're dehydrated, we put them in the food processor and blend them into the powder. So it's a nice way to have fresh cayenne, because even what you grow you get from the grocery store or even your health food store, you don't know how old that powder is before, how long it's been sitting there or where it came from. So growing your own is really the best. Okay, my husband's going to come up and talk a little bit about some of the benefits of coconut oil. Yes. I take the seeds out.
Okay. That's right, save the seeds.
Absolutely.
Okay, so coconut oil. So use coconut oil a lot. Coconut is very, very popular in the literature now. You're going to hear a lot about coconut oil, and there's some questions about this, and there's some literature, and this is the tough thing that I find when you start researching is something is going to say it's great for this, and something is going to say it's horrible for that. So really trying to figure out what works and what doesn't, and I think the way to get around that is to try to find out what it would be used for in the populations that use it. There are certain populations that use a fair amount of coconut oil. Those populations that they've studied do have very, very low cholesterol. So people were saying that it's the medium chain triglycerides in here that are doing that. And then you'll see very popular things now, like people taking, 2, 3, 16 tablespoons of coconut oil a day and trying to be able to bring down cholesterol, realize it's a saturated fat. There's certain things that are fantastic about that from a saturated fat standpoint. If you're going to use oils for cooking, right, which is maybe not ideal, but there are better oils and there are worse oils, right? Certain oils like canola are incredibly inflammatory, even though there's some research that says canola oils are really healthy for you, but when they take a look at the inflammatory side on what they've done in certain animal studies, it's horrible, right? And so you want to think about certain oils that you're going to use, if you're going to use them, and what the smoke point would be or how stable they would be at temperatures. What I really like using coconut oil for, not so much as using it that way, but using it more topical. Josiah just talked about using this as a carrier oil in the fat base, and it's a high saturated fat base, which is why at room temperature it's solid, right? But it has very, very small microseals that allow you to be able to get, as for a carrier, to be able to bring it in, and it's very stable. People generally don't react to coconut, and it has 2 very powerful acids in it. It's got one thing called caprylic acid, another called lauric acid. The lauric acid is actually fantastic as an antibacterial, and the caprylic acid is wonderful for an antifungal. And so this is one of the few oils that you can use topically that has antifungal and antibacterial effects to be able to use as a carrier. So if you have essential oils that you're going to put in there, or if you have other things that you want to make a solve out of, this can be a fantastic solve to be able to use, and it's very shelf stable for a period of time. So I really like using it. If you're going to use it internally, again, I would not use a lot of it. The saturated fat, we really don't have in nature where you'd ever have that kind of amount of saturated fat. It will alter some of your cholesterol if you're taking it daily. And yet I've had several people tell me that they take a little bit of it, and it's very, very soothing as far as stomach lining, as far as gastrointestinal tract. So seems to be some benefits from that standpoint, but like I said, my favorite is to use it more as a topical carrier. Questions? As a sunblock, you're really not going to get some of the benefits from the oil standpoint. So if you're going to use a sunblock, what you would want to use is more of a micronized zinc. Badger is a company out of Vermont that does some fantastic sunblocks. Right? If you take a look at sunblocks and a lot of the chemical structure that's in a lot of these, it's very concerning. right? And then you're putting that on your skin, and realize that your skin is an organ that will absorb things, right? But it also excretes things. So it's an organ of detox, but it's also a carrier. We're going to talk about Epsom salts later. It's a carrier to get things into you. So anytime you're going to put something on your skin, you want to make sure what's coming in, and am I comfortable with that? Comfortable with this as far as your skin is concerned. From an actual block standpoint, I've not seen any data that would suggest, and I get a little concerned from an oil standpoint, because sometimes when you want to exaggerate the effects of sun, you would cover yourself with oil. So maybe that's been your experience, but from what I've seen, no. From a sunblock, no. But if you were to add some things like a micronized zinc, that would stop it. But then I get concerned about how much zinc you're putting into your skin.
And then you'd oxidize it like crazy
Mm-hmm.
if it's on your skin and in
True,
the sun.
true. Okay.
When we talked about our apothecary gardens the other day, we showed you some pictures of our elderberry plants and the blossoms that were on there. Today I'd like to just briefly mention about elderberry with the berries. And this, as we talked about the other day, is incredibly helpful for immune boosting. For if you feel a cold, or flu symptoms coming on, even respiratory issues coming on, if you will take some elderberry, that will help to lessen the symptoms that you have, and some of the research has been shown to also lessen the duration that you might have an illness or something, or virus. So we dry the elderberries and use them in a tea. At Mountain Rose Herbs, which my husband mentioned a moment ago, they have some unbleached paper tea bags. They look like this. And I like to use these for any of the herbal teas that we grow and dry from the garden. And so you can just put your berries or your tea, whatever you're using for your herbs, inside of one of the little bags. And then you use an iron and iron the side closed. And so I steep the berries in really hot water, not quite boiling, but really hot water. And I'll let it steep for as much as like 30 minutes to really get a good, strong effect of the tea. But also, if you want to have elderberry taken more of a syrup, you can make syrup with a raw honey. Sometimes people might also put a touch of cayenne in with that as well, and to make more of the syrup. Or you can even use a glycerin base and make a syrup that is more shelf stable, because when you make it with the honey, you would want to use it within a couple of weeks. It's not something that's going to last for a long time. But if you use it in a glycerin, then that will be shelf-stable for up to 12 months. I still recommend that people put it in the refrigerator, but if you're going to leave it on the shelf, you can do that. I would say maybe 6 to 8 months if it's not refrigerated. But this allows them, it's easier for children. And I will tell you that in our clinic, we do not use any alcohol. We don't use any alcohol, and we don't use any vinegar to tincture or to fix the herbs. So we prefer, like I said, something in a honey base or something in a glycerin. And for the glycerin, to make the glycerin, or even if you're making your honey-based syrup, you would put the elderberries inside your mortar and pestle if you have one, and crush them slightly. Or you can put them in your food processor and just pulse it to crack open the berries. Put them into your tea bag, and I do that just so you don't have to strain the herbs out later. And put the water to almost boiling. Leave the tea bag in there for at least 30 minutes. You could even leave it up to an hour. And then you would take some of the tea, and you would pour glycerin in with that. And on your handout today that we're going to give you at the end, there is a recipe for knowing what the proportions need to look like. So in that, there's nothing other than elderberry and the glycerite carrier. And like I said, that's shelf-stable for quite some time. So that's a little bit about elderberry. And Josiah and Ashley Wanamaker now are going to come up and share. I know some of us sometimes might have children or grandchildren, or maybe you ourselves might have earaches that we encounter.
Don't say it.
Don't say it, don't say the word. They're going to share with you a couple of natural remedies that we can use.
Hey, Liaya, what is this? Garlic. What is garlic good for? Oh, what is it again?
What is it again?
Okay, what is it? What's garlic good for?
I don't know.
Yeah, it's good for your immune system. You know, as we classically like to say, garlic is, antibacterial, antimicrobial, which is all those things and more, antiviral, and antisocial, right? It depends on your social sphere. A lot of my friends like it, so we get along well. If the friends can't get by the garlic, maybe they're not friends you should keep. No, I'm just kidding. Just kidding. So garlic is wonderful, all sorts of applications, even to an extent, topically, but you got to be careful with that, even from a burning standpoint. But Leah, what do you like to do with the garlic?
I don't know.
Well, one thing that we found that's very helpful, just that we do regularly, and can you peel some of that? Yeah, and some of us more than others, like Leia, is we like to, whenever we're coming down with a cough or something, and I should be doing it more, just because all the things that are going on, but it's just to suck on a whole clove of garlic. And we treat that like a cough drop in a way. And so that's helping whatever bacterial or viral infection that's taking place there. Leia likes to suck on them all the time. Whenever we're doing anything with garlic, making a garlic spread or something, she'll pop one in her mouth. And also, so Joash, it seems to be a little bit more prone to this than Leia and Andriel, but they'll get earaches every once in a while also. So that earache, very painful, and I used to have them as a child too, and many of you, who's had an earache before? They can be debilitating. And so oftentimes what I'll do, actually almost every time, there's two things I'll do, is we'll make a garlic oil. And you can also do garlic oil and mullein. Mix both of those things. They have very similar properties. Just garlic oil, garlic and mullein, infuse it in a little bit of oil. And what I'll do, pretend this is like a cooking pot. I'll actually just elevate the pot on its side because it's not a lot of oil unless you're going to make some for future, but I mean, they're so infrequent that you can just make it when you need it. So have it on its side, and crush the garlic, fresh garlic. I like to crush it, then make tiny slivers of it, put it in the oil, and likewise with the mullein. So you can get mullein in powder and in herb. I'll usually do that with the herb, or cut in sieve and just strain it out. And then after that oil is just lightly heated up, just barely simmering. You're not wanting to cook that oil, just lightly heat it up to help to extract some of the allicin and other properties out of the mullein and the garlic. And then you can take that, and then that's very anti-inflammatory, but also antibacterial, antiviral, all of those things. And so we'll have Joash, sit on, lay down with a pillow, and we'll pour some of that oil, make sure it's not too hot. And then that's very soothing. Immediately, he feels much better, and he's not crying because of the pain. What's another thing we do for earaches? What do you do for earaches, Joash? Do you do anything with onions sometimes? They're very bold at home. And they know just what to do. Daddy, I need an onion. Or I need some garlic oil. And so maybe you tell us about that.
So an onion poultice does wonders. We even use it sometimes if there's a respiratory, congestion or anything of an issue there. It can be hugely helpful. And in that case, we would just chop up an onion and warm it on the stove with just a little bit of water, just enough so it's not going to burn in your pan. And that warm, moist onion on the chest can feel really good if you're having trouble breathing or you're congested. And then put that on, cover it with saran wrap, just like the other poultices, and you can keep that on. It's been very helpful for our kids when they're needing to rest, when they're not feeling well too, that warm and onion just really helps them to be able to breathe a lot better. But for the ear, you can do a similar thing, and you can even just cut the onion in half. You don't have to chop it all up. Sometimes with kids especially, you'll get pieces of onion everywhere in their room if you start to chop them up to make a poultice. So it can be handy just to slice the onion in half, and then you can warm up that onion on the stove if you want to, or Sydney will even bake hers in the oven, just lightly lightly get it warm, and so it's just starting to get a little softer. And you can put that right over the ear. I like how Kim was saying they like to call it onion earmuffs. That's such a great way to encourage the kids to wear them.
And it looks just like that too, because what do you call it, a headband type thing to keep your ears warm? Earmuffs? Ear warmer. You put an ear warmer over it, and that helps to keep it on your ear. So another thing, further explaining the poultice aspect, we use napkins a lot. You can use Chuck's pads or paper towel. We'll dice them up and lightly saute them with water, and then put them in your paper towel, which is either 2 strands or just fold it in half, and then fold it in half over, and then tape the ends so it's enclosed, so the onion doesn't get all over the place. And so if he does sit up or something, or you sit up, it doesn't just fall off. So that kind of helps to contain it, and then you can tape that to the area of your chest or around your throat or wherever. So onions have a lot of quercetin in them, and quercetin helps to decongest. It helps to break down mucus. So that's how that's working. One of the ways that it's working, to break down and decongest those areas. Also, it's really, it's good to eat it. It's good for inflammation. You can even use it for like a joint or something to reduce the inflammation there, because it's really high in antihistamines. You've maybe taken something with an antihistamine. Histamine is the pro-inflammatory, starts the pro-inflammatory cascade. So if we can do an antihistamine, we're helping to stop that inflammation, stop the increased permeability of the red blood cells, and letting more hyperfiltrate of the blood in that area, which is causing that inflammation. Okay, yeah.
Somebody who has COPD that
Oh yeah.
anything or still would.
No, definitely. So any kind of like, what is the next thing we're talking about? Because there's something, mullein. Okay, we're talking about mullein now. So yeah, that would definitely be good for bronchitis or anything where you've got a lot of congestion. You can hear it. Even if you take the stethoscope, you can hear along the back when you're auscultating there. You'll hear the gurgly sounds and the mucus there, and that's it'll help with that, decongest that. But even you want to take the mullein, like a mullein tea, and that's an expectorant, so that's going to help get that mucus out. Both in the digestive system and the respiratory system. So mullein, and even, so mullein is very good for, it's an expectorant is what they call it. Mullein is a tea, is an herb. Yep. And you can get that in powder form or cut sieve or whole leaf.
Find it in your yard.
Or find it in your yard, actually. Yep, I've been seeing mullein all around here. So definitely very good. Another thing for digestive issues, another thing that's very good is slippery elm. Slippery elm is very mucilaginous, and it's going to help put a Band-Aid, so to speak, over your digestive tract, wherever you have like an ulcer or that membrane, that mucosal membrane is wearing a little thin due to the acid production or the inherent production of those cells, those goblet cells in that area. So that would have gone better with something else we mentioned. But yeah, so mullein and garlic, very good for your health. And what are you sucking on right now?
Garlic.
Yeah, and she'll just suck on that garlic, and we will too. And if it gets a little bland, like you don't feel the flavor anymore, just give it a little crunch and more juice. And she'll eat the whole thing. She just eats it. But usually I'll have it in there for a while, and then it gets super strong, and then I just throw it out. So.
Or give it to me.
Or give it. No, I won't usually give it. So very good. Excellent.
Thank you to the Wanamaker family for sharing with us that good information. So something else that you can have in your kitchen, calendula blossoms. I showed flowers the other day when we did our talk on herbs. One of them they're not quite as fresh as they were the other day when we were here. But the calendulas are a cheery yellow little flower that are easy to grow. They readily self-sow and are able to be eaten internally. I toss the blossoms into salad. We talked the other day about how dried they can be put into rice and other dishes. It's called poor man's saffron. But there's a lot of health benefits to the calendula, but also if you make that into a tea or use those blossoms in a poultice, very healing to the skin. I usually, after I have dried my blossoms, I cover them with olive oil, and let them sit for a few weeks. Then I drain the olive oil off, and I use that along with some beeswax, and I make a salve. And that's what I would use for my baby for their diaper rash. Or you can use it for healing, for burns or scratches, anything on the skin. Very helpful for that. And Sydney actually has a testimony of how she's used calendula with her family.
Yeah, so calendula is one of the few things that's really safe and gentle for baby skin. And so my girls, I have twins, and they both would get these really dry patches on their face. And so I was looking for what can I use to put on them where it's going to be close to their mouth and it might not be such a big deal if maybe a little bit gets in there, or it's going to be rubbed on their hands and all these other things, and they have that soft baby skin. And so calendula salve was one of the things that somebody recommended to me, and so I used that on these little dry spots on their face. It was mostly from saliva and things like that. I have a thumb sucker, and it really made a huge difference on clearing up those dry patches. And I've also recommended it for other people whose children have almost like eczema spots, that dry skin spots in different places. And they've found that incredibly soothing as well for that. And it's just very soothing salve and gentle, and it usually smells really nice, which is a benefit.
Thank you, Sydney. As you can see, having dried herbs in your kitchen is really, really helpful for so many things. I know we talked a lot about chamomile the other day as well. And so thinking about what are some things that we can grow and dry ourselves, or we can purchase at the health food store. We talked about peppermint and having that on hand. There's also an herb that's actually a root that does not grow here in North America. It's rooibos. And it comes from Africa, and it is very, very powerful as far as immune support and calming the GI tract, and very high in antioxidants. I order that from Mountain Rose Herbs, and my husband, almost every evening, right, at least in the cool times of the year, he unwinds at the end of the day with a nice warm cup of rooibos tea. And of course, it does not have caffeine, but has so many health benefits to it. So you might want to look at that one as well. Okay, I'll spell it for you. ROOIBUS.
Okay. So yeah, I love rooibos. If you study, there's actually, Ellen White had said several things about different herbs, and one of the teas that she used, she said very clearly, I don't drink tea, obviously caffeinated, but she did drink tea quite often that was red clover, right, and has some of the similar properties. And she had actually asked for people back home to make sure that they got the first harvest, right, of that red clover. And we talked about clover before, phenomenal as far as a tea, which we didn't cover. We're going to go into honey now. Now, honey is a little difficult because there's so many different things you're going to hear about honey. What have you heard so far? Is it pure, right? Is it filtered? Is it unfiltered? Is it, right? Is it raw or not, right? Is it organic or not organic? You have to be careful with a lot of the statements on this, right? Because organic, how are you going to make sure that a bee is only going to organic flowers? You're not, right? But what you're really talking about in a lot of this is the processing of honey, and that is important, okay? And the care of the bees, and that is important. Because what we have in our society, as you know now, is we're not getting it simply like we used to. We're having it highly processed. So anytime you think about processing, it's getting it further away from how God intended it. And because of that, the health effects diminish in kind to how much it's processed. So you really do want local, raw, and if you can, organic. Now, technically in the United States, there's really no organic honey. Now, I know you're going to see it, but not processed in the United States. So they'll buy the honey, usually from Brazil, right? And Brazil has a way of saying that it's organic, and then we accept that that's organic, even though it's not tested. And then it comes here and it's repackaged in bottles, and it's sold as organic here. But the thing that you want to remember is that bees are going to some of the local flowers, right? So if you have local honey, you're getting some of the benefits that you need from those local flowers that the honey is being processed through. If it's raw, what you're saying is that it's not processed or heated to a point where it starts to get refined. Now that's easier to be able to get it to look clear, and that may even be graded higher. But we're not talking from this as far as a grading, as far as A or B or any of the other grading. We're talking about, does it have the properties that the honey is supposed to have in its basic form? And if you can get raw and local honey, that's really the best that you can do as far as honey is concerned. Organic is nice, but again, you can't guarantee it here. So honey, what do you use it for? Do you realize that they did studies back in 2012, and they tested every cough syrup on the market and everything that was known for cough support? And you know what the best treatment for cough was? Oh, you're so insightful. I love it. Josiah's like, honey. It is. It was actually buckwheat that was tested, right? But honey is better than anything that we have on the market, anything, right? And so when you're really talking about cough support, honey's fantastic. And if you really take a look at the history on this from an antimicrobial, it's one of the few things that is antiviral, that is antibacterial, that is antifungal. Shocking that the value of honey is tremendous and it's shelf stable, right? So the capacity to be able to use this is amazing. You can use it obviously internally. Some people would talk about, well, how is it processed? What if I'm diabetic? It actually has some anti-diabetic properties, which is they really don't fully understand, or we don't yet, but it has some anti-diabetic properties. Phenomenal as a use here. We had some talk about what would you put on wounds. Some of the best research that's being done right now, and some of the current things that we're trying to model after in more of a conventional model for medicine, is to mimic what honey does to be able to heal wounds, because nothing they found has the capacity to heal wounds like honey does. Now you'll read about different types of honey, and there's Manuka honey, and some of the different constituencies as far as bacteria, Manuka does seem to have some capacity to be more effective for healing than other honeys, but all honey is good, especially if you get it local. And so the other thing that we had talked about earlier was eyes. You can use this for infections. Right now the studies are happening because we're having antibiotic resistance. People have heard of that, right? We've used antibiotics so much that the bugs that they're going against have the capacity to change and alter, and then that drug becomes fairly useless or resistant to that, and you start to get superbugs. There's no resistance to honey, and so they're using this now for eye infections because we're starting to get limited in what we can have in antibiotics. And my submission to everyone is, why don't we use what God gave us to begin with instead of trying to go after some of the medications, right? So this is one of the things that you can use. It's safe. Again, you have to use this knowledgeably. So you're going to have to be able to mix this in water for a content anywhere from about 30 to 70%, right? And so you mix that carefully. You have to let that cool to a point where it's not going to cause any damage. So room temperature, and then you would be able to put it in the eye. But for conjunctival infections, for blepharitis, for a number of different eye infections, there's great studies on honey being able to be used for that. But again, get knowledgeable about how to do it. We don't have enough time to go into all of those. But what I can say is that this is one of the best things that you're going to want from a wound standpoint, one of the best things that you're going to want from a cough standpoint. Other questions? We've got one here and then one here. You can, essentially, yeah, absolutely. And honey is very effective. Now, you have to obviously cover it at that point. You can dilute it a little bit if you want to be able to, in water, which is what I use for eyes, because people have used 100%, and there are studies on 100%, but the viscosity of it starts to get a little difficult for the eye, right? So then usually what I recommend when I've used it is anywhere from 30 to 50%. So about cut it by half with water, putting it in the eye, and we're going to touch on this in a little bit. You have to make sure that the water is pure. So this would be a time for distilled water or very filtered pure water, right? And we have a question over here.
I'm 66 years old, and I wore glasses up to age 44. I put honey and lemon in my eye for 30 days.
Yep. Well, and there's some anecdotal studies on cataracts as well as a reversal of cataracts. It's actually documented Right, so it's the capacity for what this does, and they don't fully understand it, but it does seem to modulate a little bit metabolically how things are done, and it's very protective from an antioxidant standpoint. There's two components in it that are very antioxidant. What an antioxidant is you have things in your body that damage your body, damage the tissues in your bodies. Those are called reactive oxygen species, or ROSs, or free radicals. What this does is that sequesters or is able to kind of pull those in so that it's not doing the ongoing damage to the body. Very effective in the eyes, and I've heard, we actually have a patient that actually reversed her cataracts using honey. It's tough to use, but the thing is when you have something like this that we have no really damaging side effects for, why wouldn't you try? Is my thought process in that.
Burns, though, I can tell you, out of the limited honey burns the worst, but it's just for seconds. And I always say, put a cool cloth while this, dissipates.
And were you using 100% or not? Because if you cut that burn seems to go down considerably.
No, I was direct.
Okay, right. Which is why I do that. But again, be careful with the water that you're putting in your eye, because that can be a medium for bacteria.
And lastly, Manuka, I deliver babies, but if women have first or second degree tears, Manuka,
It's phenomenal.
oh, it sits
Yeah. And what we're talking about here is having things that are in your home that are readily available, right? Because as we've talked about earlier, there may be a time where it's harder to get access. That's one thing, but really I'll go back to what I said before. Really, we're trying to mimic honey, right? I shouldn't say we, because I'm not trying to, but conventional medicine is trying to mimic honey because of the benefits to it right now. The most advanced stuff that we have for tissue repair, for wound healing, is trying to mimic some of the properties that God has already given us. So why wouldn't we start here? All right? One more question here.
How about on a burn therapy?
You can, yeah, burn therapy. There's a few different things that I would use on burn therapy, but that can be very, very effective. And the thing that you're concerned about with burn therapy is you've got the potential for necrotic or dead skin that really then is a very strong nidus or a source for infection. And so this can be very good from an infectious standpoint. But then there's the cleaning and the constant change of that, where you'd have to watch that very carefully. And then any type of burn situation, because there's different levels that can affect the nerves, you'd want somebody to take a look at that. But this could be very successful in healing that. I said one more, okay.
Especially with local honey
Yes.
in your area, so like I've been told allergies.
Yes.
So obviously pollens and stuff that fly in the air, bees take care of, use the pollen and all that stuff. So and then they bring it back to there. So when you ingest the local honey from your area, your local allergens aren't going to affect you
Exactly.
as much.
And this is kind of an immunotherapy. So you can go sometimes and people will give you shots that are those to try to decrease your immune response to that, and you're getting this naturally from the honey. A point on that, though, be careful if you're getting your honey locally and within about 5 miles range, because that's usually the distance that bees can go. They're usually 2 to 3 miles, but they can go up to 5 miles. But if you have farms that are using a tremendous amount of organophosphates or different types of herbicides or pesticides, realize that that's going to be on the plants. Realize that the bees are going to get that, and realize that some of that is going to go into the honey. So then you're really trying to get it from a source that is local, but you want to take a look at the farms around that and see, is there a good potential for this to be able to be effective, which is why Brazilian honey, rainforest, they usually have wide swaths that are not sprayed. So why they're comfortable saying that it's organic. Yes, ma'am?
Manipulated bee pollen works very well with allergies.
Same concept, and you're getting small amounts of that allergen, and that your body is starting to learn, wait a second, I can respond, and this is okay to have it in small amounts. Yeah, absolutely. Boy, honey's popular. Look at this. 1 and 2, so back here.
I've used raw honey with some pine pitch,
Mm-hmm.
and it's very good for ulcers.
Yes. Yeah, and the honey alone would be as well. And pine pitch is very, very effective, and we just had, a talk about this. We don't have as much data on pine pitch as we do, but I will tell you anecdotally, we've got a ton on it. Yes.
I've read where some beekeepers or bee sellers, the honey, are mixing corn syrup in it. So my question is,
Yes.
is there a way to distinguish
Pure.
if it's in it?
Pure honey.
No, I understand.
Pure honey by the label means that there should be nothing but honey. But then there was China that's one point that was selling, and it was actually high fructose corn syrup that was colored, and it was coming here labeled as honey. So find somebody local. So this is why you find somebody that you know is doing good work local, and being able to support a local beekeeper in their.
What I'm just wondering is, this honey will stay, they'll keep forever.
Sure.
They'll crystallize. So if you have honey and you believe that it was pure honey,
Mm-hmm.
and if some beekeeper did put corn syrup in it, would there be a way to identify that by looking at the honey?
That's a really good question. I don't know if there was, because they had to actually test the honey that was coming from China to be able to find out what it was. Somebody who's knowledgeable may be able to see a difference as far as how it reacts. I personally wouldn't. So I mean, again, I think it's about, this is our walk from a Christian standpoint too, is establishing local relationships with people where you can support them and then be a blessing to them and encourage them, and those kind of relationships then encourage trust, that you can trust that what somebody's selling is actually good, right?
Yeah, so like anything, if you try to make connections as much as possible in your community, go to your local farmers markets. We live down in the Mid-Coast area, and we buy, and this is not raw at the moment. I'm in the middle of making berry jam, and I don't use the raw honey for canning. So I do use it. This has been a little bit of heat applied to it. But Sparky's apiary in Hope, he is so careful about his bees. We purchase our honey from him. I get my beeswax from him for all my salves and the medicinal things that I do with the honey. And he's at the Common Ground Fair. Mm-hmm. So if any of you go to the Common Ground Fair, you can visit his booth there. And it's Sparky's apiary in Hope. But like I said, he's at the Common Ground Fair, and you can get even large gallons of his raw honey there. Okay, I know we are about to wrap things up. Doc's going to talk for a minute about Epsom salts, and then we'll go into essential oils.
Sounds good. So in Epsom salts, basically it's a magnesium sulfate. So this is there are different types of salts. There are Dead Sea salts. There are Epsom salts, very high magnesium content, but also this sulfate, and that's a salt that's put together, and you're going to want to use both of those in your body. The common way that we use this, obviously, is baths, right? There are other applications for Epsom salt, but I'm going to just focus more so on the bath. Magnesium is fantastic. About a third of the American populace is depleted in magnesium. This is a way to get it through your skin. Okay? The sulfate is also very helpful for helping your liver to detox. So you've got two ways to be able to use this. You use this as a muscle relaxant, as a nerve relaxant, but you also use it as a way to detox. I usually use about 2 cups per bath, and this is a great thing to do before you go to bed. So for muscle aches, for muscle pains, but also for a detox. If you don't have time for a bath, or you don't have the capacity for a bath, foot soaks are fantastic, and you use that similar ratio. So you're going to use obviously a little bit less, about a 1/4 cup, but you put a 1/4 cup into a foot bath, warm water around 110 degrees. Use that for about 25 minutes, but it's going to be a great capacity for your body, not only from a blood vessel standpoint, but also from a detox and a relaxation standpoint. Very, very good to be able to have around. That's what I'm not going to touch on, because there's more to talk about on how much. Yes, you can, and yes, there are some studies. So yes, you can take a look at that, but in the interest of time, talk to me afterwards, and we'll talk about that, because you have to be a little more careful when you start drinking it. Okay? Yes?
Salts are great for gardens.
It is. We only have so much time to touch on it, but yeah, it's fantastic. I'm going to focus on that because it's the best use that we've had.
All right, I'm going to share on just a few essential oils really quickly. There are many, many essential oils that we could talk about, but I'm just going to go on a few that I probably use most frequently. The 2 that I use most often, I would say, would be eucalyptus and oregano, especially since the pandemic. And the best way, or the most common way that I use them, is actually in a steam inhalation. And so Josiah, I don't think he talked much about steam, but we did talk a little bit about heat. That moist heat, especially when you are inhaling it through your airways, works really well to open things up, to loosen up some mucus and that type of thing. And if you couple that with eucalyptus oil, which is a bronchodilator, you can even get further opening of those airways, which is going to help alleviate any congestion or breathing kind of strain that's going on. The really nice thing that about pairing that with oregano oil is antiviral. And so you mix the eucalyptus oil with a little bit of oregano oil, especially for a lot of our upper respiratory things that we've been dealing with over the last few years. Works really, really well to clear things up and get you moving a little bit more. The way I do it, 1 pot of water, medium-sized pot, about maybe 4 or 5 drops of eucalyptus oil, and I do maybe 1 or 2 oregano, because the oregano can be very strong, okay? And once the water is boiling, you just add that oil in there, take your pot and set it on the table or the counter, make yourself comfortable in a chair, grab a nice blanket and drape that blanket over you or towel over you so that the blanket catches the steam. And then all you have to do is sit there and breathe and relax. You want to be a little careful. You don't stay under there if you feel like the steam is too hot. Let out a little steam, okay? But if you can hang out there and take the steam in for maybe 5 minutes, that can be really, really effective on clearing up some upper respiratory things and kind of getting some mucus moving. A couple of the other essential oils that we wanted to touch on, one of them is clove. Clove oil I use most often with my children for teething. And so I just mix that with a little bit of olive oil. And it's a pretty, for my children, I dilute it pretty heavily. But you mix that with a little bit of olive oil, and you can put it on a Q-tip or something, or even if you can just soak up a little piece of cotton paper towel, and then, or even a gauze, and then you can just pack that right near the tooth if there's a toothache for an adult, or you can just kind of dab it on the child where they might be teething, and that can alleviate some of the pain in terms of in their mouth, on their gums. I would not recommend leaving a packed piece of gauze in a child's mouth. So if you're doing that, you're applying it and then you're removing it. So sometimes a Q-tip works better for children. And then I think Dr. Zach was going to talk about cinnamon and frankincense, really quick.
So cinnamon and frankincense, you use those for different. Cinnamon has a capacity for a little bit of antivirals. What we do with this is we use these cold air diffusers as far as the essential oils. Essential oils are very, very potent, very potent. Some people use them internally. I think you have to be very careful if you're going to use them internally, because this is a very, very potent form of a natural substance. I prefer them a lot of times from a diffuse standpoint, from a steam standpoint. I think there are certain applications like the clove direct, because you're trying to numb the area and you do want something more potent at that point. But if you have a cold air diffuser, these are fantastic for being able to support certain things. And so the cinnamon, clove, there's certain things that you can get airborne that has an antiviral property that you're breathing in very small amounts, and you're getting something in the lower respiratory tract that's hard to get otherwise, that's very supportive and antiviral. Frankincense, from our standpoint, it's fascinating to me. Frankincense was used on the showbread, right? And frankincense is one of the strongest antifungals that we have. Right? So really sweet to be able to have frankincense in the air, especially from an antifungal. And our homes, especially when they get shut up, or this time of year with the rain that we've had, right? The mold that we have in certain homes or exposure to has been tremendous. Lemongrass and frankincense are two that I use fairly often for that. The other one is cedarwood, and again, cedarwood has biblical background on that, so you want to take a look at that. But those are really effective for being able to use something where you would need an antifungal oil to be able to be airborne, and something that you can breathe just small amounts of. So that goes over those two, and then we're going to go into, I think, neti pots next, right? Okay. So
the frankincense they sell like the river stones?
well,
Is that the same thing?
there's different types of frankincense, right? And so you want to get the frankincense, I'm trying to think of the name, I think it's Serrata. But there's a certain type that is the Middle Eastern type that is the most studied and the most potent. You find it in essential oil form, so you can sell it in different forms, but the essential oil form is what we're talking about here, because then you can use it in a cold air diffuser. You put a few drops into the water, and then you diffuse it airborne. Okay? So on the neti pot, how many people have used this or are familiar with this? Okay? It's a neti pot. So neti pot will be used to be able to clear sinuses, right? And these are very effective for clearing sinuses, but there's also a very large problem with these that I talk about. It's not so much the technique, it's the water. Make sure that the water that you have anytime you'd use this, because you're going to use this, fill this up, you're going to put this in one nostril, and it's going to drain out through the other side, and it clears your sinuses, and it's incredibly effective. But if you use tap water that has bacteria in it, you can induce bacteria into a place that you don't want to. So this is a very important concept on this if you're going to use this, to use distilled water or to be able to boil your water, even if you're going to use seawater. Now, some people would say, I like to use seawater. Be careful with the contents that you're using, because what you'll want to use if you're going to use salt water is you're going to want to use a percentage anywhere from 1 to about 3%. Right? There's normal saline that you can get at the drugstore in little ampules, which is purified, and it has a 0.9% concentration on that, and that's very, very effective. If you want to go higher, just be careful. Don't really go above 3%. Most of our oceans worldwide, anywhere from 3 to 4%, right? Depending on where it is. in the world. But if you start going above 3%, what you're going to do is you're going to damage the mucosal lining on the inside, because that's going to leave it very dry. Now, for a decongestant, that can be very helpful, right? But on these, get something that you're comfortable with as far as water. Make sure it's distilled or it's boiled for at least 10 minutes, and make sure you're getting a salt content that is a really healthy salt. Non-iodized is ideal. You want to use mineral, or preferably what I would do is, and this is a case that I would use something more of a normal saline, which I get for my patients if they're going to use this from the drugstore. Otherwise, you'd have to make the concentration yourself. I won't go into how to do that right now. Just make sure that the water is pure, salt content's not above 3%. You'd use this about 2 to 3 times a day, and make sure that it doesn't dry your membranes too much when you're using it. You got a question?
Can you do that, just as like a preventative thing once a day?
You can, but what I find is realize that there's other things that are happening, and if you're running that across, you're going to dry those membranes, and it's a delicate balance between having them not be too moist, right, and too dry. So as a preventative, I don't prefer to do that, and I don't recommend to do that. I think that's too much. In case you would want something along those lines, I would go back to use salt water diffusing, or use a salt water steam application like we talked about up here, so you're breathing it more naturally instead of introducing a lot of it this way. Okay? All right.
Well, we are out of time, but we hope that we've given you a few ideas. We encourage you to continue learning, though. We mentioned the other day, but I want to hold this up again. This is an excellent resource by Dr. Agatha Thrash, Nature's Healing Practices. She covers all kinds of therapies and herbs and things that you can use. So we encourage you to check this out. We do have handouts. If you would like to come meet me here, I'll get those for you. Also, the Smiths have donated, for whoever would like to take some activated charcoal tabs. When you are manufacturing something like this, you do have to put an expiration date on it to sell it. These are saying they were expired a few months ago, but charcoal is fine. You can continue to using it. And I know that our family never leaves home without our activated charcoal. So please come and help yourself. Thank you for coming today.